Sales Director at Mutual of Omaha for critical illness products. And today I appreciate you joining me. We're going to go over a very popular product for us called our Critical Advantage portfolio. And within this portfolio, there's 3 total policies that you could potentially sell your clients. We have a critical illness policy, we have a cancer policy, and a heart attack and stroke policy. Now, this product has been very popular for our agents at Mutual of Omaha. I'm sure most of you on the call are aware that our flagship product is our Medicare supplement product. And what we've seen is a lot of those types of agents within the Medicare supplement marketplace, they realize if you are buying leads, we know that lead costs are continuing to rise every day. And this is a great way for you to not only add extra value for those clients, because we all know someone that's had cancer, heart attack, and stroke, whether it be a close family member or personal friend. And what you can do is not only add more value to that client by selling them a critical illness, cancer, heart attack, and stroke policy, but also you can help drive down that cost of acquisition. So one fun fact for you is, a lot of insurance carriers prior to the pandemic, what we saw is agents really had to change up the way they sold certain products. Many of you may have been selling face-to-face, and during the pandemic, you may had to pivot to phone sales. Well, this product is very easy for you to sell over the phone, and we did see a giant increase in producers that gravitated to this product to really sell over the phone. Simply because it's very easy for you to understand, it's very easy to underwrite, and we have very quick issue, which means that you get paid quicker as the agent, and there's really little to no buyer's remorse from clients. Now, the other great thing with this type of product is we have very high persistency with this type of product as well. People do not cancel their critical illness policies, which means that you have that steady income stream that's going to be coming in to help you and your family in the future. So within this presentation, I'm going to give you an overview of all 3 products within the portfolio. I'm going to give you, to start off with, a brief background on critical illness. And then towards the end, I'll go over our EApplication that we have with the product. And then stay tuned, because what we have recently done within the past couple weeks here is we've launched a national incentive contest for this product line, which means you have an opportunity to easily make more income just by submitting your very first application with us on this product line. You are going to get an added bonus. So stay tuned for that, but I'm going to go ahead and jump in here and give you a brief background on critical illness insurance in the marketplace. So critical illness insurance was actually developed back in 1983 by a South African doctor. His name was Dr. Marius Bernard, and he was a doctor on the very first human-to-human heart transplant team. So the reason he developed critical illness insurance is because back in 1983, even with medical advances then, he realized they were able to heal his patients physically, but the financial stress was really working against everything he was trying to do as a doctor, because in that circumstance for that individual, their focus should be on getting healthy, not on any financial impact that a critical illness, heart attack, stroke, cancer diagnosis could have. Because really that's what you need to worry about as an individual. It's those indirect costs that are associated with having one of these conditions. Because in this day and age, if you do get cancer, you're more than likely not going to the nearest hospital down the street to get treatment for that condition. You could be referred out to a specialist. If that happens and that specialist is out of state, you could be on airfare or have extended air travel, which is out-of-pocket cost for you. You could also be put up in a hotel for an extended period of time. You could be put on a special diet. or little things like helping around the house. You could hire out a caregiver or someone to come in and be a house cleaner to take care of certain jobs that maybe you can't get to because you're focused on your recovery. And that's what this type of policy can do for that individual in a time of need. So within the critical advantage portfolio itself, we have a critical illness policy, which is going to cover your cancer, heart attack, and stroke, as well as around 9 other conditions. This is going to be the most comprehensive, most expensive policy for that individual. Or we also offer a cancer standalone policy, as well as a heart attack and stroke policy. These two policies can be sold together. All three are located within the same application. You'll see that once we get into the EApplication. But the reason that you see carriers strip out cancer and heart attack and stroke insurance and offer them separately as a covered product is because these conditions alone make up 80% of all claims within the marketplace. So cancer is around 65% and heart attack and stroke is around 15%. Now, I want to give you a little background information on the risks associated with this. So as cancer diagnoses are concerned, as a man, I have a 1 in 2 lifetime risk of actually getting cancer. For women, it's around 1 in 3. And then on average, every 40 seconds in the United States, someone has a heart attack and stroke. So that question that I asked you to start off the presentation, or that statement I said, was we all know someone that's had cancer, heart attack, and stroke, which means this product is a great product for you to go and talk to really any client out there that you are selling insurance to. So within the entire portfolio as a whole, there are a lot of variations of the policy design that can really meet your client's budget. We offer both lifetime and term coverage options on all 3 products. So if you are an agent that is familiar with life insurance, we know that whole life is more expensive than term. It works the same way with this type of product. So if you are selling lifetime coverage on our critical illness product, we have an issue age of 18 to 64. So this will cover them until they pass away. If they sign up for a term coverage option, our issue age is 18 to 54, with term coverage options of 10, 15, 20, or 30 years. We have a built-in feature that you can tell your clients about, and it allows them to go ahead and convert any term coverage option to lifetime coverage without any additional underwriting. And they can do this any years 3 through 10 of that term coverage option policy. So it's a great way if you approach any clients that want to buy a critical illness policy, maybe they can't afford that lifetime coverage at this point. What you can do is sell them that term coverage option and let them know, hey, down the road, if you can't afford the lifetime coverage, you can convert that without any additional underwriting. It's going to go ahead and correlate to that lifetime cost at the current age that they are at. But easy selling point for you as the agent. We also do individual, single parent, and family coverage with this product. And then our benefit amounts start as low as $10,000. And we have a max benefit of $100,000 in coverage. This is going to be in $1,000 increments. Now, I want you to pay special attention to this built-in basic benefit right here. And that is because we are the only carrier that I'm aware of that has this feature. And what it is it's a built-in return of premium upon death if they are buying lifetime coverage, which means you as the agent can tell every single client you sell this critical illness product to, hey, if you never use this product or you never use this policy, you live a long, healthy, happy life. Well, every premium you pay into it is going to come back to your beneficiary when you pass away. So that is a huge selling point. It's built into the contract, like I said, on lifetime coverage. And any other carrier within the market, if they have a feature like this, it is more or less a rider that you have to add onto the policy, which is going to increase their premiums substantially. So we built this in and kept our price point very low within the market. Here's a look at all the covered conditions that we offer coverage for within the policy. So we cover the internal cancer, malignant melanoma, heart attack, stroke. Alzheimer's is a big condition that we do cover. This is a product that we see a lot of long-term care agents pivot to for any individuals maybe that can't afford that long-term care coverage or that have been denied coverage. Obviously, this isn't long-term care coverage, but having something in place is better than nothing. We also offer coverage for major organ transplant, blindness, paralysis, deafness, and then kidney failure. All of this is covered at 100%. So it doesn't matter how serious that diagnosis is or how acute, as long as they are diagnosed with any of these conditions, doesn't matter what stage it's in, they will get paid out that benefit from us as a carrier, which is a lump sum tax-free benefit that they will get paid. Now, covered at 25% is coronary artery bypass surgery and then coronary angioplasty surgery. What this means is if the client, as an example, signed up for a $10,000 policy with us, we would pay out 25%, which would be $2,500. They would still have $7,500 left within their benefit bank to use at a later date if they were to get diagnosed with any other condition. There are a couple optional riders that you could add on to this policy. We have a cash value rider, which is what I refer to as our living return premium. How this works is if you buy the lifetime coverage and you add on that cash value rider, you will start to accumulate a percentage that grows every single year as long as you are paying premiums for the product. And 25 years down the road, it'll grow to 100%, which means you can go ahead and cancel the policy if you choose to do so and get 100% of the premiums paid back to you while you're living. There's also an intensive care unit rider, which is going to pay a benefit to the client if they go into the ICU for any reason. This will pay them $250 a day up to $1,000 a day, depending on what they choose on the application. And that's going to pay out that benefit for 30 days if they are in the ICU. Now, if we take a look at the cancer, heart attack, and stroke products, there are some key differences that I'm going to point out here, but it is very similar to that critical illness product that we just went over. The reason this product has been very popular with our Medicare distribution agents out there is because of our issue age range on lifetime coverage. So as we went over with the critical illness product, we have an issue age range of 18 to 64. Well, with the cancer, heart attack, and stroke products, our issue age range is all the way up to age 89. The term coverage options here are 18 to 54. Coverages, individual, single parent, family, that's all the same. And then the benefit amounts are the same as well. One thing to point out here is we do not have that built-in return of premium upon death that the critical illness policy did cover. So that is not available on the cancer, heart attack, and stroke plans. Lifetime term coverage options that we went over on critical illness are available as well. Now, I mentioned earlier that you can sell the cancer, heart attack, and stroke products together on the same application. And it's very easy to do that. All you would need to do is choose one of those conditions as your base benefit. So as an example, I could do a $50,000 cancer policy and then add heart attack and stroke as a rider, or I can do that vice versa. I can choose the same amount or a different amount. So in the example I'm going to give you here, I can do a $50,000 cancer policy with a $10,000 heart attack and stroke rider. One thing I want to point out is one will not affect the other. And what I mean by that is if you were to go ahead and trigger that cancer policy, which means you had a cancer diagnosis in that example, we would pay out that $50,000 and you would still have that $10,000 heart attack and stroke rider in place. That does not go away. So with some other carriers, if you trigger that base benefit, the entire policy ends. That does not happen with us. We also have the cash value rider and intensive care unit rider that is available on the critical illness that we went over as well. Now, here's what agents love about the product, and that is the way we underwrite it. So if you are an agent that is signing your client up for a policy of $10,000 to $50,000 in benefit, we are only going off the application questions itself, which means there's no MIB, no prescription check, no random telephone interview. So for an example, if you are selling our cancer product, there's only 3 total questions that you need to ask your clients. These questions are: 1, do you have HIV or AIDS? 2, in the last 10 years, have you had any internal cancer? And then the third and final question is: in the last 3 years, have you had any pre-screenings for cancer that weren't ruled out as cancerous? If they say no to all 3 questions and that policy is $50,000 and below, you as the agent are going to know that they're approved for the policy because we don't underwrite it anymore on our end. Now, if you're signing them up for a $51,000 to $100,000 benefit policy, then we're going to go off the application questions. There's a random telephone interview, 1 out of 10. We pull an MIB and a prescription check. Now, it doesn't matter what size of policy you sell with us. Our average turnaround time is less than 48 hours. More often than not, it's going to be less than 24 hours, which, like I said before, you get paid quicker as an agent and little to no buyer's remorse from the client. There are some key advantages as well with this product. It's a guaranteed renewable product, which means your client is locked in on the rates that they sign up for. So their rates will not go up as long as they are continually paying their premiums and that policy is in force. And then there is no reduction in base benefits at any age. What I mean by this is some other carriers within the market, they realize as we get older, we're more likely to get cancer, heart attack, and stroke diagnosis. So at age 65 or 70, they slash your benefit amount in half. So if you're paying for a $50,000 policy and you turn age 65, well, that policy only is now worth $25,000. That does not happen with us at Mutual of Omaha. So the policy that your client signs up for is the policy they'll ultimately get. We have an EApplication and a paper app. There's no policy fee with this product, and you can payroll deduct or list fill 3 or more lives with this. If you do choose to payroll deduct or list fill, you do need to use our paper application, and then there's an accompanying form that you will find within our forms and materials page. Another key advantage with the product is our price point with the product. I can tell you, if you are comparing us with other A-rated carriers within the marketplace, we are going to have the lowest rates for your clients, which means that they're not only going to get that name brand value that your clients know and trust from Mutual of Omaha, but you as an agent are confident that you're selling them a product that is very low and affordable premiums for them and is going to have adequate coverage as well. What else with the product? We're approved in almost every single state with this product except Montana and New Hampshire, which means that if you are an agent out there that sells in multiple states, maybe you have non-resident licenses, well, you can sell this product virtually all day over the phone in almost every single state out there. Now, I will recommend there is a document within our forms and materials website, which is called the State Matrix document. And what this document is going to let you know is if any of these states have variations of the product within that state, I would definitely recommend taking a look at this document prior to selling this to any clients out there, because there are some states like California and Virginia that do have some limitations within the state on the product. Now, with this product, we are approved in full in around 43 or odd states which is the interstate compact state. So in most states out there, everything that we went over today, you will see on the product within that state that's offered. But like I mentioned, just take a quick glance at the state that you are intending to sell this product in on that state matrix form to see if there is any state variations. Now, this comes directly from my top agents out there in the field. I've asked them, how are you pitching this to your clients? What are you saying to them to get them comfortable in buying a cancer, heart attack, and stroke or critical illness policy from you? And they said, you know what, Kyle, it's as easy as just asking the question, who has your cancer policy? They tell me 9 times out of 10 that individual is going to say, well, what do you mean I don't have a cancer policy? Well, if you are an agent out there that is maybe selling Medicare supplements, we know that that is great health insurance coverage. That's going to make sure the hospitals, doctors, providers, they all get paid if you go in to get treatment for any conditions within the hospital, but it doesn't make sure that individual gets paid. And what I mean by that is you are going to see some more indirect costs that your health insurance is not going to cover if you were to get diagnosed with a critical illness condition. Now, a more aggressive approach is if you are selling maybe that Medicare supplement, once you go ahead and finish the sale, you say, well, now just make sure you don't cancel your cancer policy. And then you can get into all those indirect costs and really what the limitations are on that health insurance policy and some of the indirect costs that individual may see if they have a, like I said, critical illness, cancer, or heart attack and stroke diagnosis. Now, one thing I want to point out is with the benefits that we pay out with this policy, that individual is not limited to just using that on any health insurance costs. They can really use that for whatever they'd like. And as I mentioned earlier, maybe they need somebody to come in the house and help out with those household day-to-day duties. Well, they can do that. They are not required to spend that money on certain items. Now I'm going to go ahead and show you the EApplication associated with this product. This is located within our website at Sales Professional Access. If you have not logged into our website at mutualofomaha.com, you're going to need your agent ID. Once you have that, you're going to go ahead and register using that agent ID and then create your password. Now, our EApplication for this product is located within our EApplication section. And once you find that critical advantage link, there is 3 different things that you can do within this EApplication. You can go ahead and quote the product itself. You can go directly into the application, or you have a dashboard that's going to allow you to view statuses of the applications that you've already started or completed with us. So I'm going to go ahead and run a quick quote. Let's go ahead and choose our state. So I am out of Nebraska here, so I'll choose Nebraska. Now we can do the coverage type. As I mentioned before, we have individual plus children or family. I'm going to go ahead and leave it at individual coverage. And then let's run one maybe for a 65-year-old that is just now aging into Medicare. Now, because I did 65 years old, remember our coverage issue limit, age issue limit on the critical advantage or critical illness product only goes up to age 64. So we are only going to be able to write them a cancer, heart attack, and stroke product for this age group. So I'm going to do a cancer policy. Maybe let's do a $30,000 cancer policy for lifetime coverage. Let's hit calculate. And that premium would be $68.35 a month. If I want to go ahead and modify the quote, I can do that by hitting modify quote. Maybe I want to bring that down to a $10,000 policy and hit calculate. Now it's only $22.12 a month for that policy. Maybe I want to go ahead and add the heart attack and stroke rider onto it. All I need to do is hit modify quote again, come up here and choose the heart attack and stroke rider. Again, I can do the same amount or a different amount, but I'm going to run this as a $10,000 rider and then hit calculate. And now our premium is $43.64 a month. Now to get directly into the application itself, we'll hit apply now. This is going to navigate me to this page right here. I'm going to need to put in the commission code. You should only have one option listed as an agent. If you have more than one option and you have questions on that, please reach out to your upline, or you can reach out to me directly and I will get you squared away. But you'll choose that option and hit start application. Now we are directly into the e-application itself, and everything that we did within that quoting page is going to get transferred over to the very first page of the general information application page. So we can choose to change anything if we'd like, or we can keep it as what we quoted previously. The next page here, or one thing I want to jump back and point out to you is everything on the left-hand side of the screen here is going to be the certain pages within the application itself. So anytime that you see one of these pages highlighted in yellow, that means that you need to go into this page and complete something. Now I have an application already filled out, so for demonstration purposes, I'm going to go ahead and grab that real quick. Now the application is intuitive enough to where it's only going to show you the health questions that you need to ask the client for the certain policy that you are signing them up for. So the most questions that you will see from an underwriting standpoint is going to be for our critical illness policy. So this policy that I have as an example here is the critical illness. So I'm going to show you the health questions for that policy in a second. Once we get to the second page of the application, this is going to be the proposed insured information page. This is pretty standard to other applications out there within the marketplace. We do ask the beneficiary information, and simply we're still going to pay out any benefit if they were, maybe that client had a heart attack and stroke policy from us and they had a heart attack or stroke and passed away from that diagnosis. We're still going to pay out the benefit for that, but that is going to go to the beneficiary. And then one other thing to note here is we do ask for height and weight for any individuals, and that is because we have a height and weight chart that we use for critical illness and for the heart attack and stroke policies. We do not use it for the cancer policy. And then you also do need to be a U.S. citizen or permanent resident cardholder residing in the United States for the last 3 or more years. The next page is going to ask if there's any coverage in place, and really what this question means and what we are trying to find out from the individual is, have you purchased any other critical illness, cancer, heart attack, and stroke policies from Mutual of Omaha in the past? We do not care if they have millions of dollars in critical illness coverage with other carriers. They can only get up to $100,000 in total coverage with us at Mutual of Omaha. So if that client maybe a couple years ago had bought a heart attack and stroke policy with $50,000 in coverage, well, they can come back to us and buy another $50,000. They just can't go over that $100,000 limit. The next page is going to be your health questions. So as I mentioned, this is a critical illness application. So this is going to be all of the questions that Critical Advantage has within the product portfolio. So this is section 1, section 2, section 3, and then section 4, which you will see as the individual. So section 1 is going to always be asked. This is the question related to HIV or AIDS. So it doesn't matter what policy you're signing up for, you will always see section 1 here. Section 2 is related to cancer. So we went over those questions earlier. Section 3 is going to be your heart attack and stroke questions. And then section 4 is going to be all of the conditions that the critical illness policy does cover. So it's a 10-year look back for all of these other conditions. And remember, it is a knockout application, so the client is going to need to answer no to all of these underwriting questions in order to get coverage for the product. Now I'm going to come back here to the health questions or to the general information page and change this from a critical illness application to a cancer application, just to show you how the EApplication works. So since I changed it to just a cancer application from critical illness, now I'm only being shown questions that are related to that policy. So as I mentioned before, section 1 is always going to be asked, and then section 2 is going to be your cancer questions. The next page here is going to be the agreement section. So this is simply asking the client, where are you signing the application at? So we put in the city and state. And then there is a producer section here, which is going to go ahead and ask you as the producer, did you ask all the questions accurately and in their entirety? Hopefully you go ahead and say yes to those questions. And then down here below, you're going to see the agent information. This is going to be directly tied to your producer ID number. They should be pre-filled for you, but it does give you the opportunity to go ahead and split cases with any other producer, and you can do that with one other producer. The next page is going to be the agent producer statement. So again, this is going to be mostly pre-filled and tied to your agent ID. However, there is a middle section here which is blank, which allows you, if you have any back office personnel that you want any underwriting communication going to, you can go ahead and put in their name, phone number, and email address here. Our next page of the application is going to be the additional information page, and what this allows you to do is go ahead and add in any comments or special instructions to our underwriting team that you want them to be aware about. It also allows you to go ahead and choose where you want that policy to be sent to. So you can choose either the applicant or you as the producer if you want to go ahead and deliver that to the client. The next page here is the payment information page. The premium for that policy is going to get automatically transferred over for you. And then our first payment is going to be automated bank account withdrawal. And then we have the option to go ahead and change that from automated bank account withdrawal to direct bill if we'd like for ongoing future payments. If we do choose to do direct bill, we have options of quarterly, semi-annual, and annual. Or if we choose to keep it at automated bank account withdrawal, we can choose which day of the month we want that coming out of your client's checking or savings account. Here's the account information page. So this is where we would choose that checking or savings. We don't take credit cards with this policy. We choose one of those options there and then go ahead and put in the banking information. And then lastly, we have the HIPAA authorization form, and essentially what all of this language here is asking the client is, in the last 2 years, have you had any aliases on your medical records? And for example, maybe someone had recently gotten married and they had a maiden name on their medical records. Well, we'd go ahead and put that in this box here. Now, once we've gotten through the application itself, it is time to go ahead and request the signatures for the client. Both you and the client are going to need to sign this application, and it's very easy to do so. So there's 2 different ways for you to do this. If you are with the client face-to-face, you can simply turn your computer screen and allow them to go ahead and finish the e-signature portion. Or if you are with the client maybe on the phone, you can go ahead and email them a direct link to the e-signature portion as well. I'm going to show you how that works. So if you hit request signatures, we can go ahead and choose maybe to email that link to the client by clicking that email box and then putting in their email address. Or we can go ahead and hit this sign button next to it. Now, it doesn't matter which way that your client chooses to go to complete the e-signature portion. They will be brought to a screen that looks just like this. And as you can see, both of these boxes are grayed out. That is because I need to go ahead and open up these two documents first. So the first document we're going to open up is the MIB pre-notice, which is telling the client if we need to pull an MIB to underwrite the policy, we're going to do so. And then the next document we need to open up is the electronic signature consent document, which tells the client instead of a wet signature, we're going to use their electronic signature as their consent. And once we've opened up both of those documents, now I can go ahead and hit these agree to boxes and click sign application. Once I click sign application, I'm going to be brought to a pre-filled PDF version of the application. So this is everything that we did within the EApp that got transferred over to this PDF. I can go through here page by page. However, the easiest thing to do is to come up to the top of this and look for this next signature button. Once I click on that next signature button, I'm going to look for a yellow highlighted box with the sign button inside of it. So once I click that, the first e-signature has been completed. I'm going to come up to the top of this page again, click next signature. Look for the yellow highlighted box, click sign, and they're going to need to do this 3 separate times, and then come up and click finished. And then you as the agent are going to need to follow the same process here as well. So we'll come up and hit next signature, find that yellow box, click sign, and then you are finished. Now, the last step to do here is click this Submit to MOO button, which means this goes directly to our underwriting team. And then, like I mentioned before, we have an average turnaround time of less than 48 hours. So it is that easy for you to complete the application. Last thing I'm going to show you on this EApp is our dashboard. So as you start asking your clients, who has your cancer policy, and you are starting and completing more applications on this product line, you are going to see these show up within the dashboard section of the EApplication. So really the end game status that you want to see here is submitted. That means that it's in underwriting, being reviewed by our team at Mutual of Omaha. Anytime that you see a status that says sign, that means you need to go and click this view button next to it and click the submit to MOO button. If you see a status that says signing, that means that you've gone ahead and sent the link out to the client. However, they have yet to complete it. If you see a status that says complete, that means you've gone through the application itself. However, you have not sent that link over to the client for them to review. And then anytime that you do see a status that says incomplete, that means that we did not make it all the way through the application itself. Now, another thing I want to touch on here is we have another way for you to go ahead and quote the product as well. So if you are not familiar with this smartphone application, it is free for you to download through the Google Play and Apple iPhone store. All you need to do is type in Mutual of Omaha quotes for sales professionals, and you will see our lion head logo pop up. You download this for free. You don't need to even register for it. And this product, as well as many others, or I should say most of our products, are actually located within this easy iPhone or Android app. But you can go ahead and quote it, very easy. So definitely, I urge you to go ahead and download that if you don't have that currently on your phone. Now, last thing that I want to go over with you today is we just started an incentive contest for this product line. So this is nationally for all agents out there to qualify for some extra cash from now until June 30th of this year. So we've got quite a ways to go within this incentive contest. And if you are a producer on the line that has not ever sold one of these policies from us at Mutual of Omaha, it's a great way for you to go ahead and start selling this product, because your very first application you submit with us, and once that application gets issued, you will go ahead and qualify for an extra $25 cash bonus from us. Now, it's very easy to actually qualify for more rewards as well selling this product. So at the end of the contest period on June 30th, 2021, if you sell anywhere from 2 to 4 applications with the Critical Advantage product, you are going to get $150 from us. If you sell anywhere from 5 to 7 applications, you're going to get an extra $200. If you sell 8 to 10 apps, you're going to get $250. And then if you sell 11 or more applications with us, you're going to get an extra $500 bonus from us. So it's a great way, like I said, to get familiar with the product, but also help make some added income. Now, another bonus that we've got within this incentive contest is if you are one of the top 10 producers with the most apps, you're going to also get a waterproof Fitbit Charge 4. So definitely, I urge you to go ahead and start asking your clients, who has that critical illness, cancer, heart attack, and stroke policy currently. Start selling this product, approaching any client out there that has maybe had a friend or family member personal experience with a cancer, heart attack, and stroke diagnosis. So it's an easy way for you to add extra value for your clients out there, but also help you make an added income stream as well. So from that, I'm going to go ahead and open it up to any questions that you may have. And if you do have a question, please feel free to type it in the chat box.
Yes, absolutely. Thank you so much, Kyle, for presenting. You went over a whole lot of stuff today, so thank you so much for doing that. Like he said, please use that questionnaire box, you guys. Type in any question that you have that you've been saving throughout it. Kyle, I do have a couple questions myself, actually. Where can people get more information or get that same information about that incentive program that's going on right now?
Great question. So you can go ahead and email me directly if you'd like, and I can get you a flyer on this incentive contest that we are running, or I can send that out to you if you want to go ahead and distribute it to everybody. Or if you're looking for maybe a copy of the PowerPoint or any sales materials, I can get that over to you as well. And a lot of this information for the product is going to be located within our website, within the forms and materials section.
Perfect. Awesome. Yeah, that might be something that might be good to put in that follow-up email that we're sending out after this. We do have a question. We might need a little bit more information on here, but they just said WinFlex web quoting ?
Okay, I know exactly where they're going with this. So yes, you can go ahead and quote this on WinFlex Web if you are familiar with it. I usually try and avoid talking about WinFlex Web just from a personal viewpoint. It's not as easy as our EApplication or the mobile quoting tool to actually run quotes with the product. But if you are maybe a producer that likes to go into the point of sale with an illustration, you are able to get illustrations, a 2-page illustration from WinFlex Web. That's the only way that you can get an actual illustration, is quoting it within WinFlex Web. However, the EApplication and the mobile quoting tool is going to be a lot easier to use from a functionality standpoint.
Perfect. Becky was asking if this is recorded. Yeah, Becky, this is recorded, so you can go back and rewatch it. It will be in our follow-up email. So that way, if you're confused about something or you just need to rewatch it, it will be in that follow-up email. I have a question about the EApp. I like to ask these questions because sometimes technology can be a little finicky and it's a little specific. For your EApplication, I saw that you were using it on Chrome. Is Chrome the best web browser for it? Does it work on all web browsers, or there's some web browsers that it just doesn't like? How does that work?
That's a great question. So, my go-to is always Chrome for everything, but if you are somebody that uses a different web browser, I haven't had really any producers out there that have gave me negative feedback that it's not working. But if for some reason, maybe you're having some issues, that's a great point. Maybe switch over to Chrome to go ahead and run the EApplication. But what I can tell you is the EApplication actually does work on your smart tablets as well. So maybe you're a producer out there that doesn't like taking their computer. Maybe they like to bring in that iPad in the point of sale because it's lighter, it's easier to carry around. You can actually do this on your iPad, and I've had producers tell me, in one instance, I had a producer call me and tell me, hey, I was actually at church today, and I didn't have my laptop or my iPad, but I was able to use my phone to actually go through the EApplication and complete it that way. So it does work on many different devices.
That's awesome. Thanks for bringing that up because we do get questions a lot. No, we get questions a lot. Well, is this accessible on my iPad? Is it? A lot of people sell off of iPads now, or they take it around. It's just easier to have than a laptop. So awesome. Alrighty, guys. I have one more question for Kyle. So go ahead and put those questions in the questionnaire box. If we don't have any, then we'll just wrap it up here. But actually, John just asked a question. He said, I just downloaded the app. It looks great. I appreciate all the good info in the webinar. Wondering how much is the agent commission on these products? Yeah, I'll let you handle that. If that's something that you don't want to discuss right now, I know that senior marketing specialist, our outreach team, can talk about that with you, because it may vary, but Kyle, do you have anything that you want to say on that?
Yeah, so commission is always, one of the top questions, obviously, that's on the mind of agents, because we make sure that we want to get you compensated for your efforts. Now, in my position, I don't talk about commissions because we have great partners out there like senior marketing specialists that are distributors of our products. So I would recommend you to reach out to the support person at senior marketing specialist to talk about your commission, and they will go ahead and get you squared away.
Yeah, absolutely. We have a whole team that could talk about that with you and would love to talk about it with you. So go ahead and give us a call if you have some questions about that. You just mentioned this, but honestly, I can't remember. We just had a question. Will the slides be sent out today? Is that something we can have, or do we just want to send out some other resources in that follow-up email?
No, I will send you the slides directly to you, and then I will send you a bunch of accompanying materials as well, some of which I mentioned today on the call, like the state form matrix. I'll send that over, and then some additional information that you can send out in the follow-up email.
Awesome. Thanks, Kyle. I have one more question for you. Sometimes we get on our end, we get a little bit of pushback on some agents adding cancer products or critical illness products to their portfolio. Sometimes they don't see a need for that, and we push really hard to try to get them to think the opposite of that. So if you were talking to an agent that maybe was a little bit skeptical about it, what would be the one thing that you would tell them to maybe convince them otherwise of how important it is to have a product like this in their portfolio?
I think the need. So, from our standpoint as a carrier, and what I see from other carriers, and we had a kind of a brief conversation earlier, and prior to the pandemic, I would travel 60% of the time, going to conferences, different events, meeting with agents, brokerages out there that are customers at Mutual of Omaha. And it's within the last couple of years, what I've seen from not only Mutual of Omaha, but other carriers within the marketplace, is there's a lot more focus that we all are putting on these types of products with critical illness, cancer, heart attack, and stroke. And that is because all of us see the need for it. We've seen that there has been these type of products have been undervalued in the United States as compared to United States or the United Kingdom and Canada. If you would compare United States and United Kingdom and Canada, this type of product is actually one of the top sold products in both of those areas. So all carriers across the board see the need for this type of product simply because it does fill the gaps, but it is an emotional sale, because if you're an individual that has had this experience firsthand, maybe you have had a father, mother, family member, they have seen the financial impact this can actually have on that individual. And we know that stress, it's no secret, but stress, it is a huge contributing factor to heart attack and strokes, as well as cancer. So any ways that you can alleviate stress is going to go ahead and help out that individual. So when they are at a time of need and their focus really needs to be on getting that recovery in place to get over a certain condition that they've been diagnosed with, they don't need to worry about, they shouldn't be worrying about, oh, how am I going to pay my mortgage? I'm currently in recovery mode. I can't go to work because I've had a heart attack or stroke, but I still have all of these other bills to pay. And really, the average savings account in the United States is less than $2,000. If you think about mortgages out there, how many months is $2,000 going to go ahead and cover for that individual on their mortgage if they don't have that income stream coming in? So like I mentioned, there's varying degree of certain bills that individual could have that they kind of take for granted, because our most important asset that we have, if I would ask people that question, most of the time they're probably going to think of something tangible, something they can look at and see, which could be our house, maybe our car, but it's really our income. Our income is our most important asset. If we don't have that and we don't have an income coming in, we need products out there in place to protect that. And that's really what this policy does. It's going to help pay those indirect costs. Because even if you have a client out there that signs up for a $10,000 policy with us, and they are diagnosed with cancer, I can confidently tell you as a producer that $10,000 after they're diagnosed with cancer is going to be worth way more to that individual than the actual monetary amount. And you're going to look like a hero for that individual in that time of need as well. So hopefully I answered your question. I know I kind of went on a tangent there.
Absolutely. That was a wonderful. I couldn't have said it better. Thank you so much. We're right there with you. So it looks like we don't have any more questions, so we'll go ahead and get this wrapped up today. Thank you so much, Kyle, again, for the plethora of information that you gave us today. Be looking out for that follow-up email, everyone, and we will let you get back to your day. Thank you so much.
All right. Thank you. I appreciate having me on board.
Absolutely. Bye-bye.